Welcome back to the Art of Patient Communication Perspectives. Today's topic is something that happens in our clinical rooms all the time, often consciously, which is the use of vivid descriptive language to communicate with our patients so we can simplify the procedures, the outcome, pros and cons for them. So today we will be discussing this with Dr. Jimmi Patel. Jimmy, to begin with, I would like to say that we often use metaphors and analogies in our clinical day-to-day practice to explain the procedures, like really simplify so they understand. But there is a very fine line where that the purpose of education turns into a manipulation. And that's what I want to unpack today, because I believe that the way we say, the words we use plays a very important role in our relationship with the patient.
I think language is everything in terms of building the relationship with the patient, because like language is not just the verbal language, it's the body language, the tone and everything else. But at the end of the day, words are the most important part of the language, and the words and the choice of word. First of all, the objective is to take consent from our patients that, if they're happy to go ahead with the process and if they're happy with our overall approach. But then that consent or the process of taking consent, if that was difficult or, uncomfortable for the patient, where they didn't understand it or they felt pushed in one way or the other, that difficulty or the easiness in that process then decides how much they trust the healthcare provider, because over the years that trust then builds into the relationship. Because so there are three layers in my from my point of view, that the language helps you take consent, but then it builds into the trust, and then it builds into the relationship with your patient. And that's when you stop becoming just any other healthcare provider. You're not just a doctor or a dentist. You then become, their doctor, or they start using the word, he's my dentist, or she's my doctor, or he's my physiotherapist. So, it's shaping that relationship and going from just a professional to almost an integral part of their so-called healthcare family or healthcare team is the goal. And that's how the word and the language is extremely important in my view.
That's right. I think in just what you are saying, that it actually helps you, the words help you build rapport with your patient, which is when if the trust has been built, then they would go and tell other people about you, like, go and see my doctor, or go and see my dentist or my physiotherapist, because he's really good and he really listens to you and he does what you want.
It is essentially the comfort. And I talk to my associates and any other young clinicians that we come across is that how easy do you make it for your patients to say no to you? And if you can make it super easy for them to say no to you, then you are winning. It's like in any other relationship. If in the relationship, any relationship, if it's hard to say no, that means the relationship is not at a comfort zone. So
that's right. They're feeling pressured or pushed.
Yes, so they are not comfortable saying their true mind. So you have to make the process super easy, where if they feel like saying no to you, it should be very easy for them.
That's right.
Yeah, let's talk about what exactly is this vivid language that we're talking here.
Yeah, so I think vivid language is essentially it's a tool.
Of course,
right? Where what we use to communicate any procedure with our patient, we simplify the pathology, the clinical pathology, we simplify that because the patients can't read the clinical signs in their mouth. So we have to show it to them. Then they can't understand the severity of the problem. So we again simplify that. They don't know what's the prognosis, as in how it's going to pan out over years. So again, we simplify that.
So essentially, it's the language not only just used in health professional, but in any other professional setup where if you are not aware of the subject, the person is helping you understand in a simple words using sort of analogies and sort of some examples.
Yeah, that's right. Like for example, we are currently designing our home, right?
Yeah.
And that's the analogies they are constantly using with us because we are not
simplified.
we don't know the terminology. That's right. Yeah.
So basically, vivid language is essentially the language that helps bridge the gap between a professional with years of technical knowledge to a lay person who doesn't understand what we're trying to explain. So that's the language. But then, like any other clinical skill, it requires calibration because if it is used too much, then it can turn against you.
Yeah.
And that's the point we have to understand, because there is a subtle difference between clarifying your diagnosis or situation versus really amplifying your diagnosis or a situation.
Yeah.
Because the outcomes from the patient's point of view are completely different.
Yeah.
And even as clinicians, as we'll discuss probably in a minute, even as a clinician, they're different for you as well.
Yeah.
Yeah, when you start amplifying
100%.
that you say. Yeah.
Because you can use of vivid language, like it can turn into a shortcut to get a yes from the patient versus actually educating them and getting an informed consent from the patient. And I think that is the fine line that we want to be really, really watching.
So basically, when it's not done properly, you are pretty much
instilling fear.
And you are taking it from explanation and then turning into a real compliance that they just have to do it.
They just have to say yes. Yes. That's right. Yeah. So, Jimmy, you talked about that you've been speaking to some clinicians and they have been to some training courses where they go through a whole lot of training when they are a young graduate outside university. And one of the lessons that they are being taught is use of vivid language. And because we are dentists, we only speak to a lot of dentists as well who's been in there. So do you mind reading some of the examples that those young graduates have shared with you with the training they are being provided right now in terms of using vivid language?
Yeah, let's look at them. Yes, I think some of these are quite interesting. And of course, the listeners can understand we are coming from the dental point of view. So these are the dental examples. So they go something around. So if you are trying to explain the patient to receive a dental crown, the language is, this is what they're being taught. There is a large crack running through the tooth from front to back. And if we don't put a crown on, the tooth is going to explode and you're going to lose the tooth. Then the second version is your tooth has 90% crack and only 10% tooth. And if we don't put a crown on, the tooth is going to shatter and you will end up losing the tooth.
So the words like explode, shatter.
So they are the main punch in the whole line. And then there are a couple of others which are around accepting the root canal. So they're like, there is a hole in your tooth and it's basically holding bacteria, and the bacteria are eating the heart of your tooth away. And if we don't act now, you're going to lose the tooth.
Yeah.
And then the tooth is dead and there is an infection spreading in your jaw, which can be life-threatening and it needs immediate treatment. So these things just go on and on. And when I read these things, to some degree, I laugh, but at the same time, I feel quite sad about it because, touch wood, we are in a profession where life-threatening scenarios are very rarely seen, at least in a GP sort of setup.
Yeah.
And
I think we are in a developed country. And
yes, so you are not going to come across very easily
the
life-threatening scenarios. And when we use these languages, we are seen as professionals who instill fear. Yeah. And if anything, it is going to work against us and against us as a profession, where general public's sort of view towards us is quite negative because the language sounds very negative.
Yeah, it is.
Yeah.
Like, if you think about it, why do you think they are doing it? Like, why are the clinicians doing this? Or why do they feel the need to do this?
Look, sometimes, and again, this is just, I'm trying to rationalize the need. I don't see any reason why we should use this language. But if I really want to make some points for it, then I would say sometimes the decision-making process from the patient's point of view can be quite long. Some individuals can't make decisions. So yes, there is a time pressure, there is an appointment time and scheduling. So you want to help people make decisions faster. So that's one thing.
Yeah.
I do know in some setup, dentists do work with some sort of targets. So that
the financial pressure.
The financial pressure. That could be another reason why they could be using this language.
Yeah.
And sometimes it's just an innocent mistake where, the young clinicians, they've just heard that, okay, my senior or someone they look up to, they use certain language where they do certain procedures more number of time in a year. So I'm going to use the same language. So it's an innocent mistake and they don't think it through and they just start using the language.
And they are training the young graduates who haven't had much life experience.
That's correct.
Who haven't been challenged by the patient enough number of times.
Yeah.
And they're just using it.
That's correct. So I think there are some of the reasons why I believe it's being used, but at the same time, unintended harm is still harm.
Yeah,
so
absolutely.
I suppose it's not helping anybody.
Yeah. And Jimmy, you and I, we both work in a regional communities, which are like very, very tightly knit, and the word travels very fast.
Of course it does.
And coming from that, how do you think this can actually harm the reputation of a clinician, or how it can affect them basically in the long run?
So as I touched on it earlier, that these tactics or language, it not only is harmful from the patient's point of view, but it is harmful for the clinician and as well as the business in general, because it can cause a lot of reputational and brand damage, individual brand as well as the business brand, both, because you are seen as someone who uses this language to get treatment over the line. That's one. And B, no one, as human beings, we learn this from our little kids. They don't like pressured decision-making process. They don't like to be told what they should be doing. So any decision that's made with consent and a healthier consent is always going to go through much positively compared to a forced decision-making. And clinicians don't realize, but patient is just saying yes because they haven't thought through the entire implication of that decision, financial, the time commitment, the procedural complexity. So these things they haven't thought through completely. And they've just said yes. And if when the process gets a bit more complex and difficult, which a lot of time it does, then the compliance drops. They stop coming to the appointment. There are a lot of failed appointments. They cancel a lot. They either don't go through the entire treatment. And then we may even lose them as a patient. So it is damaging to the clinician and the business in general as well. But to me, that's always the second part of the puzzle. To me, the first thing is, and the first reason is good enough that, we're doing harm by using the language to explain these things in a very sort of amplified manner, just to get the compliance from the patient to say yes.
It's a very one-sided approach, isn't it? It's like, I want to get this treatment approved or over the line, so I'm going to use this language to convince the patient, whereas ideally it should be discussed as a team. So you are working with that patient, you are helping them out, and it should be both of us coming on the table and then discussing, it
has to be a dialogue.
Exactly. And I think then unpacking that and then providing a treatment for them. Whereas using vivid languages, it just sounds very one-sided. Like, this is my agenda and this is what I'm going to get out of it. Yeah. Have you noticed a particular pattern in trying to use the vivid language when the clinicians are talking to the patients to get their agenda ticked off?
Many, many years ago, I just went on this very famous sort of training on case presentation. And I think one thing that I did notice there is that the objective in that technique was to create this psychological and time pressure, because it's not just okay to get your patients to say yes to your treatment plan, but it is also a must to make them say yes, and I'm happy to start with it right now. So there's a psychological pressure of saying yes, and then there is a time pressure of I want it today. So that was the outcome, best case scenario.
Like now or never approach, like I can do it
so
today.
It's like now or never. So they have to be put in a place where patients need to feel like, if I don't do this today, like I'm just going to miss out, or there's this really bad outcome just waiting for me tomorrow morning type scenario. So that's what they're trying to achieve. And then the way it's achieved is through the language of where you are creating this predictive certainty that if this is not started today, or if it is not done, then this very dangerous event is going to happen tomorrow. And there's a sense of embarrassment and fear instilled in patients, where they just, because you're just exaggerating the entire clinical presentation through your words in patients' mind, so that they just say yes and they say, I want it today. So that's the pattern that I picked in this style, which I could never do it. And it's just because maybe it's not in my fabric to do things the way they explained. I'm a very shy person in that regard. So that's something that I observed.
Yeah. So just on what you said, Jimmy, we'll just do a little role play. I'm going to give you like the vivid version of the sentences, and then I would like you to positify them for me. Okay?
Yeah, let's try that.
So the first one is, because again, for the listeners, because we come from dental background, so we will be using a lot of dental examples. So the first one is, this tooth is crumbling. It can collapse any day.
It's a classic, this one.
Yeah.
Look, I would just simply say that the tooth structure is weak, and it will be better if we want to keep it for long, that we strengthen it or support it through more definitive care.
Yeah.
But at the same time, it's not broken right now.
Yeah.
So we can always make that decision along the way. And these are the pros and cons of doing it soon versus not doing it at all.
Yeah. Perfect. The second one is, if you don't do this root canal today, the infection can go into your jaw, and this can be life-threatening.
Okay. I would just simply say the tooth is infected, and the only treatment that we can do if we want to save the tooth is through, let's say, root canal treatment. And like any other infection in the body, if we don't treat it in the timely manner, it's only going to get worse. And worse means more sort of negative outcomes. So
swelling, pain.
So it can cause some unexpected sudden pain and swelling episode.
Yeah.
So if you want to prevent that, then we're better off scheduling it or doing it sooner.
Yeah.
Once again, patient understands the pros and cons of doing it now versus and not later. Doing it at all versus doing it later. And then they make a choice, because at the end of the day, it's their tooth, their life, their health, their choice. So
and I guess, Jimmy, like normally you would tailor this information for the patients based on their attitude towards care. Like if you had a patient who was very proactive and who was ready to go to any extent to get his health in order, I guess your words would be different versus someone who's only reactive in their nature, and they just say, look.
That's always the case, because you have to, again, we have to understand people. We are not treating teeth, we are treating people individuals. So you always keep that in the center of everything that you do and say with human beings. So of course, my choice of words will be different depending on who I'm dealing with and how serious the scenario is. But what I do know I won't do is that, again, clinical exaggeration of any scenario is something that, I do not align with. It doesn't matter who the person is.
Yeah, that's right. And the third one is you are really putting yourself at risk by delaying this decision making.
I would probably say slightly different in a way that, yes, there are some benefits in doing the procedure sooner.
Yeah.
But at the same time, for whatever reason, whether it is time, money, or personal circumstances, if you can't start the treatment or do the treatment soon or today, you can prioritize it, where you can do some part of it soon, and then the other part you can stage it. And like most things in life, there are again positives and negatives of everything. You discuss them with your clients, with your patients, and then they understand what it means to delay it.
Yeah.
And then again, the ball is in their court and they make a choice. They make an informed choice, and everybody is happy that way.
I think it's very important to understand that we bring the clinical expertise to the table, and patients bring their circumstances, their financial, personal circumstances, their beliefs, their values, all of that to the table. And we can't just be dictating the terms based on our agendas. We have to bring their information on the table and marry it all together, and then help them or facilitate the decision making.
And that's what we always promote in our practice, that it's a collaborative treatment planning,
co-treatment planning.
Yeah, it's a co-treatment planning versus, I'm the subject matter expert and this is what should be done.
Yeah.
There are only very rare case scenarios where, in dentistry at least, where you have to pretty much dictate 100% of the terms.
That's right.
There are very rare case scenarios.
Yeah. Let's give the listeners something more practical to take away from this podcast today. And I think as I was writing this episode, I thought that maybe we can think of the word vivid in a positive frame. So if I use the word vivid as an acronym, so I would say the first V stands for visual metaphors. So again, still use the visual metaphors to explain the patient of what you are seeing.
Use the example that they can start visualizing in their head.
Correct. That's one. Then the letter I to support that with images or scans. So if you have them, you put them on your screen and you show them. So there is a correlation with what you are saying with what they are visualizing. Okay. Then the third V is for values. It's very important to have your value system in check, which is you are saying the right thing, something that you would recommend to your family member. That should be there while you are using the metaphors, showing them the images. Have your value system in check. And then saying all this with a lot of integrity, which is not using words that instill fear in patient. The last one is to remember that, which we have multiple times touched on, is the dialogue. This is not that when we sit on a table to discuss the treatment plan with the patient, it's not a monologue. It's not my agenda. Just remembering that, I believe, is extremely important. And it's a dialogue. So I bring my clinical expertise on table, and patient brings their life's knowledge, their financial status, how much they can spend, what do they want to do. Some people have reservations about some treatment. They just don't want to do them.
Yeah.
They have heard stories and they don't want to do it. Doesn't matter how much of a good clinician I am. Doesn't matter how much of a good speech I can give about that.
Doesn't matter how much research that supports the treatment. They just don't want to do it.
And we have to take that into account while we are sitting down and having a conversation with them. So so vivid acronym in a positive way. So that's what
that's a very interesting take. And I think, from my point of view, the way I remember is, am I stating the fact or am I inflating the clinical scenarios? am I using my language because there is a clinical urgency, so I'm using it to explain the clinical urgency, or am I creating an emotional urgency that, the patient are now feared to not do something straight away?
Yeah.
And they are the things. And then am I gaining clarity, or am I gaining fear by using that language? So they are the things that I would always keep in mind. That my descriptive language should help me achieve those things, and not the other outcome, not fear.
Yeah.
And the one line takeaway is clinical urgency is ethical if that's the situation you are in, but emotional urgency is unethical, where you are using fear and other emotions for the patients to go ahead and get the treatment done.
That's right. So to our clinician listeners today, vivid language is a positive tool when it is used in the right way, not to amplify the diagnosis, but it should be grounded in clinical objectivity. Is that your take, Jimmy, or do you have a message to add here?
Again, staying in your lane, I suppose. I was speaking to one of my associate just literally last week, and she was getting quite passionate about, presenting this case to the patient. And I just said that because she was really worked up, what if the patient says no, and I just said, look, you have to understand that every time you present to the patient any solution, you have to stay passive, because yes, it is good to believe into something, but at the same time, you have to do a passive presentation where you are only stating facts and what the real picture is, and then let them make a decision from their side of the story that, okay, does it fit in my budget? Does it fit with my timeline? Do I believe in this treatment? So they need to see the value in what you were saying. And if they do, they will say yes without you trying anything hard. And if they don't see the value, then they're going to say no. And in both case scenarios, everybody is better off, because it's a decision that's made with a discussion.
Yeah. Thank you, Jimmy, and to everyone listening. So please remember that your words matter as much as the treatment you deliver. And here's a question for you to wrap up this podcast. Have you ever changed the way you describe the diagnosis or a prognosis to the patient because it caused fear or confused the patient? Please share that with me via DM or email me. Thank you for listening. I hope you got something out of it. Like, follow, and subscribe, and you know where to do that. See you next time. Bye.